Hello, my name is Nick Nelson, and I'm a licensed massage therapist at Kino. And today we're going to focus on Swedish massage. We're going to do our best to answer probably the biggest question around Swedish massage is, what is Swedish? So Swedish massage is elongated strokes, strokes you might hear effleurage and petrissage and tapotement in words like this. And these are some of the strokes that we use while performing a Swedish massage. So today, as we can see, we're starting with the leg, and these strokes are our effleurage strokes. These are our long, using the palm of my hand strokes, and we're investigating the tissue. As we perform the stroke, we're feeling beyond the skin. And these strokes typically are soothing for deeper work that may come. This is you introducing to every body part yourself to the client. And here we're working along the tibialis anterior, and we're using our thumb effleurage stroke here. And the most amazing part about Swedish, when you get really good at it and you start to understand it, it's all about the transitions. Moving from one piece to the next piece seamlessly. The client feels as if it never stopped, but you're done with one part of the body and you're moving to the next. But again, it's all connected. And here we're going to put that leg, if you will, back together, and then we're going to move to the thigh. So these are our closing effleurage strokes. And now we're going to make our transition to the thigh. So Swedish massage can have many layers. It can get pretty deep if you allow it. You can stay on the surface. And when I say surface, I don't mean rubbing just lotion on the skin. Staying on the top layer of the muscles, not going too deep. Because here, if you're working with the quads, you do have a muscle that lies underneath some of these quad muscles. And you don't even have to worry about that. If you don't want to, you can stay on the surface, or you can anchor down into your stance and you can glide deeper into these strokes. And here we're focusing in on the IT band, doing a little, it's cross fiber, and you can also say it's maybe cross fiber effleurage. Again, we're using the heel of our hand to provide the pressure that's needed. We're sinking down into our stance, and we don't want any power coming from my arms, if you will. All of my power comes from my legs in these strokes, and I'm just anchoring down as I move throughout these strokes. And one of the coolest things about Swedish is that you get to use so many tools. And when I say tools, I get to use my forearm, I get to use my palm, I get to use my fingers, I get to use my thumbs. These are all tools that I have access to while performing my Swedish massage. And again, it's all about it's about the transition from one tool to the next tool. One body part to the next body part. I like to tell my students that once you've made connection, your job is to never disconnect. Now, there will be times when you have to when you're doing your draping, but once you begin the work on that body part, try your best to never disconnect. So next we're moving into the abdomen. Now, the abdomen, the majority of clients that come in have never had their abdomen worked. It's going to be extremely new to them, and it's a sensitive area. It's for someone to touch your abdomen. You got to think it's one of those parts of the body that is not guarded by bone. You're very vulnerable in this area. And students sometimes can be a little hesitant when working in the abdomen, but if you trust yourself and you know that you don't want to bring harm to this person, that comes through the touch. And when I work in the abdomen, if I'm already moving slower, I'm already moving at a slower pace, I slow down even more when working in the abdomen. And the most powerful part when working with the abdomen is making sure that that connectedness that you have with that client is coming through the palms of your hands and not through your fingertips. There is a huge difference when working with the heel of the hand with the palm and working with the fingertips. I like to tell the students that when I work with my fingertips, I'm investigating, I'm thinking, and the client knows that I'm thinking. But when I work with the heel of the hand, I'm feeling, and the client is feeling as well. This is one of my favorite things to do in the abdomen is working with the intercostal muscles. I have a tight thoracic spine. It's very hard for me to turn my upper thoracic. And this stroke, that last stroke, allows you to give a little bit of a twist to that thoracic spine. It's very gentle, but when you have a tight, like me, thoracic spine, it feels incredible. And this is another really fun technique is when we work with the diaphragm. Diaphragm to me is basically, it's almost like the powerhouse of energy. Your ability to breathe deeply, strongly is like, it's like getting a natural espresso shot. So I want to make sure that your diaphragm is able to expand and contract the way that it needs to provide powerful breath. So this is extremely interesting. And I don't know if you all can see that Bill allowed me to sink a little deeper this last stroke. That's trust. I got to thank Bill for that trust. And one of the beautiful parts about Swedish to me is it's like music. What makes music so powerful? It's rhythm. It's predictable. You can fall into it like a trance. That's what your strokes should be for the client. Rhythmic. Should be trance like for them. I think here I'm running my mouth as we talk about breathing and the diaphragm, how we don't breathe in 360. And that's what I'm explaining here is working with the diaphragm allows a bigger, deeper breath. Because typically we breathe, if we want to think about it, front to back and not side to side. So sometimes this diaphragm work allows the side to side opening up. So you get this up and down and side to side, giving you that full bodied breath. And again, we're going back to those rhythmic strokes. This is when I get to bring some comedy out when I'm teaching. So right now we're doing what's called the C's, like ABC. So we're with our hand, we're performing the shape of a C, and we're tracing the intestines. So we start at the ascending colon, transverse colon, and descending colon. And little joke I make with the students is it's time to scoop the poop. And that's, we're scooping along the intestines. And you'll hear stomachs growling and all that stuff, but it's amazing for the digestive system. So here we're coming to a close. And typically we close like we open. This particular technique is called hand over hand or sun and moon. We have one hand making 360 and then one hand making like a 180. So now that we're done with the abdomen, we're going to move into the shoulders and the arm. And we're also going to work into the pec as well a little bit. So the first thing we want to do is that we're working into pec major. Pec major goes and it connects on to the humerus, the head of the humerus. And you'll be surprised how many people don't know that your pec actually stretches over into your shoulder, if you will. So that's what we're doing now because we want to work on the deltoids. But before we do that, let's do a little work on the pec first. And again, we're opening with our gliding strokes using the heel of the hand. And we're addressing the deltoid. Right now, we're addressing the anterior deltoid. If you want to think about it, the deltoid has three muscle groups: anterior, posterior, and middle. And so now we're moving into the bicep. And typically what I like to do sometimes is use that arm as a handle. It gives me a different angle on the bicep as I do that long effleurage stroke up into the shoulder. All right, so we're going to continue the work. On that angle, you couldn't really see the work into the forearm. So we're going to focus on that, but we're going to open the same way that we did on the other side, is working into the anterior deltoid. We're going to work into the trapezius and we're going to work into the pec as well. So again, that pec comes all the way over and attaches onto the head of the humerus. So giving that some love makes things a little bit easier when I want to go in and work with that anterior deltoid. And here I'm just focusing on getting as many, I'm trying to touch as many parts of the deltoid that are exposed to me. I can't really get to the posterior, but I can definitely get to the middle and anterior. And again, I want these strokes to be extremely rhythmic. I want Bill to be able to predict the feel of the stroke. It's almost like his mind can float away because he knows what to expect. And here we're going to work into the bicep. Again, I use the arm like a handle so I can manipulate how I approach and how I touch the bicep. And you'll be surprised how many students are afraid to move their clients while they do work. And I encourage it, honestly. Your client won't mind if you move their arm a little bit or, move their head a little bit so you can get a better angle on things that you want to access in their body. So now we're going to go and we're going to focus on the forearm. I will tell you this right now. The majority of your clients will love you for your forearm work. Um, right now, we're focusing on the extensors. So these are the muscles that basically open up the hand. You know, if you were to place your hand over your elbow and wiggle your fingers, you would feel these muscles move. And Bill is a handyman. So he's always using his hands. He's always using his wrist. And here I'm focusing on a muscle called brachioradialis. Um, Bill's was really tight just because of the work that he does. And me twisting his wrist allows me to manipulate that muscle underneath my thumb. If I had to give the stroke a name, it would be cross fiber friction. So now we move into the hand. And one of the most interesting muscles is your muscle of the thumb, thin arm eminence. Um, Bill's was extremely strong. Again, he's a handyman. He uses his hands a lot. So I could really work into that thin arm eminence muscle. And again, I want to close kind of how I open. I'm connecting everything back together. I want Bill to understand that he's not parts. You know, he's whole. And that's the goal at the end is to, you know, I tell my students, put the client back together. You quote unquote broke them down. Now put them back into one piece. All right, so now we're going into the next sequence of the Swedish massage. And again, if I had to rate which one do clients enjoy more, neck or back, it's a tie. It's a tie. And so during the neck, I'm really feeling for the upper trapezius muscles and I'm feeling for the occipital muscles as well. Very tiny muscles that lie at the base of the skull. And just like when working in the abdomen, I want to make sure I move very slowly. The neck is delicate, and you want to make sure that you let your client know that you respect this very delicate area. And most of the time when I'm working, this is when I get the snores. You get people fall asleep here. It's beautiful as a body worker when a person feels relaxed enough to fall asleep in your presence as you're working on their body. It's a huge compliment. So we closed up the next sequence and we had Bill go prone or had him lie on his stomach. And just like we did when he was supine or lying on his back, we're going to start at the legs and we're going to work our way up the body. So here we value when we teach our students draping. It's one of those things where in the beginning it's a little scary because you don't want to mess up the draping, but there's so much time to practice and there's so much hands-on training that you get used to draping and you become very comfortable with your skills in draping. So again, here we're starting out with those long effleurage strokes using the heel of the hand. Palmer, effleurage. And now we're focusing with those effleurage strokes, opening up, addressing the calf muscle, and we're getting some of the soleus as well. So we're getting gastrocnemius and soleus. And here, again, we're switching our tools. We went from heel of hand or palmar effleurage into thumb effleurage. And again, the goal is to make these feel seamless, never messing up the rhythm. And here we have petrissage. So this is going to be like you're kneading strokes. It's almost like you're kneading dough. And I guess one thing I can point out there is even when we have to take that break to apply more product, whatever you're using, whether it be lotion or oil, you always have a hand that stays in contact. Because it can be quite jarring when you take a hand away and put it back. It disrupts the flow. And here we're working with the hamstrings. Bill's hamstrings were pretty tight. So I made sure when I felt the density of his hamstrings, I was like, okay, I need to go slower here. Because if I go fast, it won't feel good to him. And he may guard. And the last thing I want is muscle guarding. So here we're using cross fiber friction, and that's typically a deep move. And so you want to go slow whenever you're going across the fibers. And here we got to incorporate a little bit of forearm work. And I tell students when you're working with that forearm, get as close as you can to the glutes because you want to take it into the attachment, that stroke. You want to take that stroke into the attachment of the hamstrings, which is on the ischial tuberosity. So now we're working with the glutes, and the glutes we typically do over the sheet. Powerful work, especially when you're working with clients that suffer from low back pain. A lot of clients that come in, they may opt out to have the glutes worked on, but they say they have low back pain. So now you have to come in with your knowing and your expertise as a therapist and say, hey, almost coax them and make them be okay with having the glutes worked on because you understand that these two areas are related so closely that if you say you have low back pain, it could be coming from these areas. We often, we try to teach the students where the pain is, the problem isn't. So you experience pain in the low back, but the problem could be the hamstrings or the glutes, or it could be coming from anteriorly from the abdomen as well. And again, we're just going to focus on giving Bill a very secure and comfortable drape. A drape that allows him to feel secure and the sheet to be completely out of our way. I often tell students, mind your tucks. And what that means is tuck that sheet away so that you can work comfortably. I guess here's also a good chance for you to see the stance that I'm in right now. So whenever you're performing your longer gliding strokes, you assume a stance called bow stance. We call it bow stance. This allows you to simply bend your knee, that leading knee, to travel the length of the body. And when you're on your return stroke, you bend that back knee and you just allow yourself to fall back like I did there. Your stance How you stand during a Swedish is extremely important. You have to think you're going to be on your feet moving you're going to sit down when you're working on the neck. But other than that, you're going to be on your feet moving for about 50 minutes. That stance is what's going to allow you to have longevity during the work. Your ability to draw power from your legs and not necessarily your arms or your back or your shoulders. Sadly, as therapists, they give us an expiration date of 3 years. Typically, one of the reasons as to why we burn out, if you will, is due to injury. And a lot of those injuries can come from low back or thumbs. So again, your stance allows you to take pressure off your low back, and utilizing all of your tools allows you to use other things other than your thumbs. Swedish for me over the years, it's become a dance. It's become a waltz. It's me working with these tissues, and we're moving back and forth with one another. And I'm paying attention to how my body is moving as I manipulate these soft tissues. And here we're addressing the glutes on this side. Again, this is extremely important for clients that may be having low back pain. And some of my students they become concerned when working with the glutes, in the sense of how do we make sure that we don't make a mistake and go into areas that we shouldn't be going into. There are points of contact that I show our students, like, hey, if you stay within this little triangle of work, you will never make a mistake and go into areas that should not be worked on. So you made it. Here comes the best part. This is the part that your client's been waiting for. They appreciated everything that you just did, but they've been waiting on this. This is the back. So here, I'm just investigating. I'm seeing what I can feel through the sheet, any areas of tension. And I want to think about this as if I'm peeling back a layer, because if I can feel things through the sheet, then that's already letting me know what I'm going to feel when we go skin on skin. So with the back, just like all these other body parts, we're starting out slow with our opening effleurage strokes, and we're traveling the length of the body. So something I always like to have students aware of when they're working on the back is to stand to one side. Because if I stood directly over Bill's head, he has a face cradle, and that would make me have to work further away from my point of contact, therefore making me bend my back more. But if I go to the side of the table and I go into that bow stance, I can travel the length of the back and not compromise my lower back. While working in these areas, my favorite thing to address are the erectors. So those are your posture muscles. These are your muscles that basically help you stand up straight. And a lot of people, we have poor posture. So these muscles are always under a little bit of tension. And when you can bring relief to those muscles, your clients will come back 100%. So something that I didn't mention before, when we're working with the limbs of the body, like the arms and the legs, we work in a way that's centripetal, meaning that we're moving towards the heart. All of our strokes go towards the heart. When we're at the back, we don't need to work that way. It's like you can do whatever you want to do, however you want to do it. As long as you're mindful of what you're doing, you will never hurt your client. And I think that's one of the most beautiful parts about Swedish, especially when it comes to the back. It becomes this free flow. And this is when you can get really creative. Utilizing all those tools, thumb effleurage, fingertip friction. Here we have forearm effleurage, working on that erector spinae muscle group. And also when working with the forearm in the back, I like to always tell students that you're never going to make contact with the elbow. You know, you're always going to work with your forearm, so you don't have to worry about sharp pain. Again, being mindful of the stroke. This is one of my favorite things to do. I love to stack my hands. So for me, I'm right-handed. So my power hand is my right hand. So when I'm working on the left side of the client's body, it can get difficult for me. So I like to stack to give me the power that I need to really work deeper into those muscles while I'm on the client's left side. It's normal that you're going to have a stronger side that you typically like to work on. That's absolutely normal. And you figure out ways to make it comfortable for you to perform these strokes, again, in a mindful way. And here again, we have that forearm effleurage. And if you can see, I never work with the elbow. And that's hard in the beginning. You'll be surprised that this stroke for a lot of our students, this is a tough one. But again, there's so much time and there's so much time to train that you get this down. In the beginning, it's a complex move, but after you've done it 3 or 4 times, you get the hang of it. And again, here we're just connecting the back, connecting all those places that we just worked. And we're slowly bringing things to a close. Again, this is what your clients are waiting for. So here, what I like to typically do is, this is me kind of like wiping off the product. Not having my client feel, like they have too much product on their body. And this is also a good way for them to understand that things are coming to a close. This is one of my favorite things to do to close out things is the trapezius squeeze. And typically we like to remove the bolster and we thank our clients for coming in.